Hi, my name is Marissa Chapman. My topic for this PowerPoint is mental health access for college students and for young adults. Okay, so something that I want you as the audience to think about is what happens when someone knows that they need help but they're unable to get it. This is a very important issue that many young people face because mental health affects how we think, feel, and act. Many college students and young adults experience anxiety, depression, stress, and other mental health concerns, but they never end up receiving treatment. Mental health issues among young adults continue to increase, but access to care remains limited. Many students know that they need support but face barriers that prevent them from getting the help. Some of the biggest barriers include cost of treatment, long wait times, shortage of providers, lack of transportation, fear of stigma, and judgment. I included a little chart at the bottom left, and that's just from the CDC website. It's a statistic. It shows that 29% of US high school students report having poor mental health. So basically, a third of US students are reported to show that they have poor mental health, and a third of students is a pretty high percentage. So it's not very good. Um, Mental health affects nearly every part of a student's life. Um, it can impact academic success, your relationships, your physical health, your future career, and then just any other opportunities. Um, it can cause anxiety disorders, depression, burnout and stress, eating disorders, and post traumatic stress disorder. Um, this is really important because young adults who do not receive support can struggle for years before seeking treatment. And waiting, like the longer you wait, it can be a lot more harmful to you, and it can cause a lot of these things to happen that might not have happened if you were able to get the help that you needed when you needed to get it initially. Um, so there are different experiences and inequalities. Not every student experiences mental health care the same way. Research shows that racial and ethnic disparities affect whether students receive formal mental health support. It also shows that young adults with autism spectrum disorder often face additional challenges when transitioning into adult healthcare systems, um, which is really sad. Many lose access to support services after leaving their pediatric care. So now I have some solutions. I have a couple slides of solutions. Um, for my first solution, I thought that maybe increasing access to mental health services on college campuses would be smart. That would just give more access because there would be more counselors, shorter wait times, and just expanded support programs. Um, if you're needing to get mental health through your college, um, college students are very busy. You have a lot going on, and if wait times are super long, or there's a really big shortage on counselors, it's gonna discourage people to go and get the help that they need. I think with all the stress already on your plate, being a college student, I think having to add something else that's gonna take a very long time to achieve and get done, I think it doesn't seem like it's an achievable goal. So I think having more counselors and having shorter wait times would help a lot. For my second solution, I have to integrate mental health care into primary care settings. Um, so that would just make services easier to access, reduce barriers to treatment, and that would allow earlier intervention. I think this one is super, super important because of what I was mentioning earlier. The longer that you have to wait to get the help that you need, um, it can cause a lot more issues and make life a lot more stressful or sad or more difficult for you. Um, I also think you can teach yourself to deal with things in an unhealthy way if you don't have the correct help that you need. I think being able to access this help early and when you need it is a lot better for your mental health, and it would definitely be a lot better on you not having you get the things that can happen if you wait longer, like getting like anxiety disorders and other things like that. For my um, third solution, um, I have reducing stigma through education and awareness. So something I learned from the TED Talk I chose, Lori's TED Talk, was how changing the way people think about therapy can encourage more people to seek help. Um, and I agree with that. I think many people avoid treatment because they feel embarrassed, or they think asking for help is a weakness. And I think that can happen just through the way that you're raised, through hearing what your parents say, hearing what your friends say, or even just the people around you through school or through work. I think just hearing people talk about it as, it's something that's stupid, or it's a waste of money, or you're weak if you need to talk to somebody to get help. Um, I think that is definitely something that a lot of people hear growing up, and I think that it definitely can discourage people from getting the help that they do need. Um, so I think reducing all those negative thoughts people have about mental health care would definitely um, help a lot. For my fourth solution, I have increasing awareness of available resources. So there are organizations like NAMI that provide support, education, and resources specifically designed for young adults and families. Um, I think this is huge. I don't think a lot of people realize how available mental health is. Um, I think it needs to be more available, but I don't think people realize how achievable it is a lot of times to get the help they need. I think a lot of people can probably get the access through either their insurance, their parents' insurance, their jobs, or their schools. I think a lot of people don't realize that those are benefits that they can get through those things. Also, I think a lot of people just think that therapy is like extremely important or extremely expensive. Before I started researching this, I thought that therapy was like extremely, extremely expensive. And after looking into it, I have seen that it's a lot cheaper than I thought it was. So there are probably a lot of people out there that think that it's like a very unachievable um, price. So they don't even look into it. So I think that's something that needs to be talked about a lot more. People seeing the different options they have and seeing how available it is to them, I think would make a big spike in the amount of people who are able to get the help that they need. So why this matters to my audience? My audience is parents and guardians of high school students in rural Ohio. Um, Many mental health challenges begin before students enter college, and parents are often the first people to notice warning signs. So I think those are the people that really need to hear. Um, the more informed parents are, the more likely young people are to receive the support before problems become severe. Mental health access is a complex problem with no single solution. Um, However, improving access to care, reducing stigma, and increasing education and expanding support services can definitely make a very, very big difference. Just remember, you are not alone. No student should have to struggle alone simply because help is too expensive, too far away, or too difficult to find. This is my Works Cited page. It is a link. I'll attach the link so that you're able to view it. The links were very, very long and they would not have fit on a slide or even two slides. But that is all I have. So thank you.